Before we begin with the overview, let us first talk about the seriousness of Sensate therapy. While there isn't anything dangerous about the exercises, it can be emotional and may uncover repressed feelings. If there are other serious issues within your relationship, such as previous trauma, it may be necessary to assess if this is the right time to start Sensate therapy. It requires being on equal footing and showing vulnerability. If there are other issues within the relationship, discussing with a qualified psychosexual therapist may be helpful. If you and your partner agree to starting Sensate therapy, the first step is to establish ground rules. These rules need to be mutually agreed upon and understood. Otherwise, the sessions will not work. First rule is the most difficult. During the exercises, there is a ban on sexual intercourse, and at the start, also on genital touching. If a partner is aroused, he or she can masturbate if necessary after the sessions are completed, but on his or her own time. There should be no attempt to involve the partner in intercourse, so please do not even ask. Second rule is to try and set up time to do the exercises at least twice weekly. Setting aside time without stress or pressure to do other things is essential. Start by spending 20 minutes on the exercises and increasing to 60 minutes in total per session over 4 weeks. Third rule is to not talk during the exercises in the beginning, unless your partner's touch is uncomfortable or painful. Do not have conversations about unrelated matters. As the sessions progress, communication will become key to let your partner know what is pleasurable and what isn't. But during these sessions, please only stick to conversations about what is happening in the sessions themselves. Conversations about outside matters will only distract from your own sensation and not allow you to reap the total benefits. Finally, we want to emphasize that these exercises are all about learning to stay within your body and within yourself. If it turns out to be difficult, don't worry. This is all about learning and practice. Instead of getting worried, approach it with curiosity and flexibility. If you start thinking about grocery shopping when your partner is stroking your back, ask yourself what that means and how you can remain present in the moment instead. Now that we have the ground rules, let's start. Let's talk about how the program works. Sensate therapy is laid out in a series of stages, which slowly increase the intensity of sexual touch. Stage 1 involves no sex and no genital touching. Stage 2 includes genital touching and exploration, but no intercourse. Stage 3 includes penetration, with slow progression towards movement and orgasms. The exercises are meant to be taken slowly. Do not rush through the program because this just encourages performance pressure. If one partner feels like one part is too slow or not enticing, the other partner may feel pressured to push forward. Instead, make a pact to continue at a steady pace with no pressure to rush forward. We hope that you enjoy the exercises that our experts have laid out. If you feel that it is still a struggle and you are feeling overwhelmed, consider getting advice from a qualified therapist. And remember, communicate with your partner after the session is over and how the two of you are doing with it and how you felt during the session.